Hey there, friends. Welcome to the Having a Mom Moment podcast, where we dive deep into the world of motherhood and beyond. I'm your host, Shannon Warner, and I am excited to embark on this journey with all of you. Here's the deal. This podcast is your ultimate sanctuary, your sacred space to hit pause on the chaos of mom life and reconnect with the amazing woman behind the title of mom. Yep, it's all about those precious mom moments because, let's face it, we all need a little more time for ourselves. Am I right? So what can you expect from our time together? Well, picture this. We'll be soaking up wisdom from fellow moms, sharing their stories and triumphs and how they've tapped into alignment on their own motherhood journeys. It's like a mom-to-mom chat over coffee with a sprinkle of inspiration and a dash of humor thrown in for good measure. We're here to light up your soul, to remind you of your incredible power, and to celebrate the unique spark that makes you, you. Because when we take care of ourselves, we become unstoppable forces for good in the lives of those we love. So join me as we laugh, learn, and rediscover the magic of this crazy ride called motherhood together. Get ready for your weekly dose of connection and encouragement, because around here, we don't just mom. We mom with purpose and power in alignment with our true selves. Stay tuned, my friends. The adventure starts now. Hello, my friends. Welcome back to the podcast. I'm so glad you're here. I am so excited to share this week's episode, but before I do, if you listen to the podcast regularly, you noticed I didn't put an episode out last week like I had intended. It just did not work out for us, friends. I just have a lot of things going on behind the scenes right now, things that I am excited about, all good things, but I would be doing all of the things, this podcast included, a disservice if I continue to juggle all of the balls in the air at one time. So I'm going to choose very deliberately to set this one down, at least in the current capacity in which I am operating under, but we're not going anywhere, okay? I promise you, and I'm excited for what's next and the things that I am preparing to embark on behind the scenes here. And as soon as there is news to share, I will share it here. So again, all good things, but thank you for your grace and space as we take a brief pause from full-blown podcast production over here at Having a Mom Moment. So our guest this week is Lynn Schulte. Lynn has been a birth healing specialist and pelvic health physical therapist for over 30 years. She founded the Institute for Birth Healing, an educational platform for practitioners, and Center for Birth Healing, her clinical practice. She has been helping thousands of moms heal from all the issues women experience after birth and is now teaching courses to bodyworkers to help them do the same. She found a common birth pattern that shows up in the pelvis after birth and knows how to release these patterns effectively. Knowing we are more than just our bodies, Lynn works on all levels, physically, energetically, and spiritually, with women to help them access their full potential. She also teaches bodyworkers how to respectfully work with the body's tissues and access and use their intuition in bodywork sessions. She offers a certification process to help birth professionals become birth healing specialists. Lynn holds a Bachelor of Science in Physical Therapy from St. Louis University, St. Louis, Missouri, and is on a mission to improve postpartum care worldwide. And after listening to her, I think you will agree that she is absolutely on the path to do so. And I'm so excited to share this with you. I don't have much to add in this conversation. This is basically a pelvic floor health masterclass held by the incredible Lynn Schulte. And I hope your takeaways are as amazing as mine were, because I learned so much in this conversation. So I'm so excited to share it with you. And let's take control of our pelvic floor health, ladies. Here's Lynn. Welcome to the podcast, Lynn. I am so excited to have you here today.
Thank you for having me. I love any opportunity I got to share what I love and know.
I know this is going to be so good. And I know this is so important for moms. So could you please tell our listeners about yourself and the work that you do?
Lynn Schulte is my name, and I am a pelvic health physical therapist. I've been one for over 30 years. And when I moved from Seattle to Boulder, Colorado in 2008, I started just working with postpartum women. And that's what allowed me to discover the common patterns that I kept seeing in all of my postpartum clients. And once I figured out what was really going on with them, I figured out how to treat what I was finding. And my postpartum moms were getting off my table in one session and out of pain, and one session no longer leaking. Yeah, it was pretty, I was stunned myself, but everyone getting off the table like, oh my God, I feel so much better.
Wow.
And I knew that I can't see every single mom in the world. And so I knew I had something that I needed to teach others. And so in 2016, I founded the Institute for Birth Healing and have been traveling the world teaching other body workers how to support pregnant clients and how to support healing after having a baby. And I just find it's so needed. It's so necessary for anyone who has a baby. And I just want moms to understand more what's really going on in their body, what the changes that have happened, and why their body might feel the way it does after having a baby. So that's what we're going to talk about today, okay?
Yes, I'm so excited. First, I am so glad that you recognize that you've got something so important, and then to take that to share it and teach it with others so that they can share it. Huge.
Yeah.
That ripple effect is huge. So that's
I
so
know.
exciting.
It is
Oh,
exciting because
amazing.
it's, it's not just me. The effects that are the results I'm getting in the clinic are the same that my students are getting as well. And
Great.
so when you know what to look for in the postpartum body, it's pretty easy to figure out what needs to happen to help that to get better. And I see it daily in my clinic where I can get someone's pelvic floor muscles. So your belly and your pelvic floor muscles are the two muscles that get so stretched out with a vaginal birth. If we don't end up having a vaginal birth, your belly muscles and your pelvic floor muscles are still affected, just not to the same degree as having a vaginal birth. And when you help put things back together where they're supposed to be, everything can function so much better. And I can take someone where we get just a little bit of contraction. Like if you go to contract your pelvic floor muscles and it is effortful, it does not just automatically turn on, turn off, and have good strength. That is a muscle that needs some attention. And I can take someone with what I do, I assess at the beginning of the session when I do my intravaginal work. So I do, as a pelvic health physical therapist, I do intravaginal work with the pelvic floor muscles. And we just use a gloved finger. We don't use a speculum or anything to work with the tissues internally. And I assess to see how a muscle is functioning at the beginning. And usually there's like 20, maybe 30% of the muscles are actually able to contract. And then after I do my magic internally and help move things around, then the muscles are able to function 80, 90% in one
Wow.
session in,
Wow.
in 5, 10 minutes of work. It's pretty miraculous, the changes that can occur. And yet not every pelvic health physical therapist knows how to do this. And really, it all started when I started noticing the bones of the pelvis. I've always been intrigued by the sacroiliac joint. That's the joint on either side of maybe the dimples in your low back. If you guys know what we have these little bumps back there. Sometimes people have dimples there. That's around the area of your sacroiliac joint. And I've always loved that joint. And realizing the pelvic floor muscles attached to the pelvis, they influence that joint. And so I've taken what I've learned over the years on the pelvis and I've applied it to the postpartum body. And I started to discover, like, why are the bones doing this? Why am I finding this in the body? And I realized it's because of the way the baby came out.
Hmm.
And and so your sit bones, what needs to happen for a baby to be born vaginally is that your sit bones need to splay apart and your tailbone needs to lift backwards for
Okay.
widen the pelvic outlet for a baby to come on out vaginally. Okay.
Yes.
And what I was finding is that one side would be more splayed out to the side than the other. And I was like, why is that happening? Shouldn't the baby just come right out the middle? That's what
Wow.
I assumed, but
Right.
it's not. It depends on the position you were in when the baby came out.
Please say
So,
more.
so if someone is birthing and let's say they're on their side, the side they're laying on can't move. So the top side has to move more in order for that baby to come on out. So it's very possible after birth, depending on how the baby came through. If a baby comes through in its optimal way, there's less effect and strain on the pelvic bones, and they don't have to open up as wide. And so there's an easier possibility for it to return to its original position.
Hmm.
Babies that come through in occiput posterior, or they come through asynclitic, or it's a more challenging way, baby got stuck. Those are all signs, or baby had a hard time coming through the pelvis. Those are signs that the pelvis is being stretched, possibly beyond its ability to return to its original position on its own.
Wow.
Okay. And so
Hmm.
now we're stuck with these bones in this widened position that it's not their normal. And that can create back pain, pelvic pain. Your pelvic floor muscles are attached to these bones that have just widened and the tailbone that lifted backwards. So now your pelvic floor muscles are all on stretch. And if your bones are in a very unstable like position, your pelvic floor muscles are going to do whatever it can to help keep you stable. So they're going to like try to tighten down to pull your bones back to their original position. So there may be pelvic floor muscles that are like really super tight. And if you go to a pelvic floor PT and you've got these tight muscles and they don't address your pelvic bones and they force those pelvic muscles to relax, that can make your pelvic pain worse
Wow.
because your pelvic floor muscles were trying to do something for you. And that pelvic floor therapist didn't realize that the bones aren't in their proper place. Now they just cause those muscles to release and you stand up and now you're in more pain because you're more unstable.
Wow.
So it's important to recognize that the bones of the pelvis are meant to come back together again. They're meant to do that on their own, but it's these ways that babies come through that make the bones like really overstretch and kind of get stuck there. Actually, there's an exercise that anyone can do at any time, no matter how old your baby is, that can really help address your pelvic bones and help to try to bring them together. And that's closing the bones exercise. And I have it on my YouTube video channel, and you guys will put the links in the show notes, okay? So you can check that out. But it just uses your thigh muscles, your hip muscles to help bring the bones back together again. So it's a really super easy exercise you can do on your own, and that can help those bones come back together again. Now, in an ideal world, I would have every single person who has just given birth do this to their body right after the baby comes out, because then the pelvis isn't stuck in this open birthing pattern for years.
Yeah.
And the longer it's been stuck in the body, the more effort, the more energy it takes to help it to figure out what normal is again. But if we just do this right after birth, the body doesn't even remember the birth. It knows how to come right back together again. So it's super helpful for the pelvis. But when the bones are stuck in this open birthing pattern and you've got back pain, pelvic pain, or maybe you don't at all, but yet you have insertional pain with intercourse, those pelvic floor muscles may be on stretch and they're not able to relax to allow penetration to happen. So if you have insertional pain with intercourse, that is a pelvic floor muscle issue. And the other issue could be scar tissue. It could be, scar tissue doesn't allow the tissues to stretch as normally as they should. The bones being stretched and out of place can put stretch on the muscles. And the other thing that I have found is, and any of us that are moms know that our kids never put anything back where it belongs. And the same thing happens intravaginally, intrapelvically as the baby's coming on out. So what I find is that the bladder gets smushed off to a side, usually the left. The cervix can be found anywhere after birth in your vaginal space. And there's tension kind of pulling it out of place. And as that baby comes out, if you tore, that can create scar tissue. And so all of that, when I get the bladder back into midline, when we help release the cervix internally in your vagina is actually at the top of the tube. So if your vagina is a tube with the vaginal opening. We call it the introitus, is the opening at the that you can see into. But at the very top of that tube is supposed to be your cervix. And your cervix should be like a piñata in there. It should be able to move 360 degrees and pull up and out of the way.
Huh.
Okay. So there's supposed to be all this mobility in that vaginal canal so that when we have intercourse, all that thrusting can move things out of the way. But if we have a cervix that is restricted, and C-section scar tissue can cause the cervix to be restricted, then when the penis goes to thrust deeply, it's hitting that and it creates deep thrusting pain. Okay.
Yes.
And
Okay.
so getting that cervix to move freely again helps the pelvic floor muscles to become stronger
Mm-hmm.
instantaneously. So if there's any restriction, any bladder not in its happy place, cervix restricted in any way, that can minimize the function of the pelvic floor muscles. Scar tissue can minimize the function of it. The bones being out of place. There are so many things that can cause the pelvic floor muscles not to be able to function fully and strongly. And really, all that women are taught after, it's like, oh, just do Kegels. Just do Kegels. And if you have any of these issues going on internally, it is the same as someone telling you to beat your head against the wall to get rid of a headache.
Yeah, I can imagine. I have
Right.
learned more about my body in the last 10 minutes. And I know some of my listeners are like, wow, wouldn't that have been nice to know? And I know some women do preparation leading up to the birth and learning about what their body's going to do to support the birth. But then, the baby comes out and that's the end of it.
Right, right. And I'm here to tell y'all that there is so much that can be done to heal. There is so much that we can support in helping this area to function better after birth because it really does take its toll. And let's talk about scar tissue. So if you tore or you had an episiotomy, that can inhibit the muscles from being able to be strong again. And if you tore and you had a grade 3 or grade 4 tear, what that means is that that tear went into your anal sphincter muscle, the muscle that is meant to hold your anus closed. And when we have scar tissue, and I have to say, postpartum, I find that this muscle always has knots somewhere around. It's a circular muscle. And as that baby comes through, it really stretches and puts a lot of tension on that anal sphincter muscle itself. And I always find knots in it. And
Wow.
if you tore into it, there's scar tissue that can inhibit it. And so another common issue after birth is that sometimes women feel like, number one, they can't hold their stool in. Like if they have to go, man, they have to go right away. There's no holding it back. Or they feel like they can never wipe clean. So they constantly wipe and wipe and wipe, and it's just like it's constantly not clean. And what's happening is that the anus is being held open from the scar tissue, from those knots that I was talking about. And what needs to happen is, ideally, that sphincter muscle is held closed. There's a sphincter muscle that is meant to be held tight. Well, if we tear into that or we get a couple of knots in there, and usually there's not just one knot, there's several knots in this muscle, that can cause it to just be held open. And it may have lost its reflex to completely close again. And so that's why when stool comes out, there's no closing of it to close it up so that you can wipe and then be clean. So it's just kind of helping. And then the stool is just held right at that opening. And so we need to get in there and release the muscles of this sphincter muscle. We need to get rid of those knots and work on the tissue around this so that it can close again. And so sometimes if you do get that wipe, you can't wipe clean, see if you can try to tighten your anus, pull your anus up and inside of you, and then relax and then wipe and see if that helps. Because sometimes you can actively close it, but you can't, it should be held closed automatically. But if that gets disrupted, sometimes you can voluntarily try to close it with a contraction and see if that helps. Okay. Another more awful condition is called a fissure. And a fissure is an open wound in the anal canal near the anal opening there. That that anus needs to open 360. It needs to widen 360 in order for the stool to come out, and then it closes back down again. Well, if we have knots, let's say we have knots at 6 o'clock in the anus, those knots don't allow the circle to widen evenly. It's going to hold that 6 o'clock spot. So then 12 o'clock is going to have to open up even more because 6 o'clock can't. And that's usually where there's the tear that creates the fissure. Okay. And fissures are just the most horrific thing to experience because it's like pooping glass every
Oh,
time you go to have a bowel movement. I
wow.
know. I'm really getting into the weeds here, aren't I, with this? But
No,
it's,
this is so good because I know there's somebody listening going, "Oh, I didn't want to like ask somebody about that. I
right.
this had this experience."
Yeah.
Uh,
So what needs to happen to heal the fissure, and if you go to a doctor, they're just going to give you ointment for it. But that still doesn't stop it opening up every time you have a bowel movement. What can help is by releasing the knot at 6 o'clock so that the whole structure can now open up more evenly. And then there's less stress on where the opening is. So we're now taking all that strain at 12 o'clock and we're distributing it evenly more around the circle. And that can help the fissure to heal better. So just know that there's some manual techniques that we can do to release that tissue so that that can heal better. Okay.
mm-hmm.
That's and that also helps with hemorrhoids too. If you have a hemorrhoid, usually there's some knots in there that need to be released so that the hemorrhoids can heal and decrease the pressure on those vessels. Okay.
Fascinating. Yes.
So yeah, so that's and with one of the things that I find in the pelvis is the sacrum, the tailbone needs to lift back for birth. And I call it the hidden pattern in the pelvis because it looks normal and most people miss it. Even I miss it sometimes when I'm looking and working with my clients. And so I call it the most common yet hidden pattern in the body. And one of the main signs that you have a sacral flexion pattern is that you hate laying on a hard surface on your back.
Mm,
So if you do yoga and you have a sacral flexion, like it hurts to lay on your back because your sacrum is pushing too far back into the floor and it hurts. And so we need to help bring that sacrum forward again. And there are things that, your therapist can do with you, and then you can do some things to support it at home to try to encourage that. But I do have a list of students that I have trained in my directory on my website. And you can go to that website and go to the directory and see if there's someone in your area that can help support you in doing the things that I'm talking about here. Because unless someone has trained with me, taken one of my postpartum courses or my pregnancy course, they're not going to fully know how to help you. And most traditional pelvic health therapists who have not trained with me aren't looking for any of these things that I'm talking about. Okay. So if you're
yes.
seeing a pelvic health therapist and you're not getting any better, they're probably not addressing your bones. They're not addressing the intravaginal space in the way that they could if they knew better. They're doing the best they can. They're with what they know. They just don't know more. And my courses can help them to know more. So if you are seeing someone, there's nobody in your area that's trained with me, encourage your PT to take my courses. They can take them online or in person, and that will just help them to get you better results. So if you demand that from your therapist, hopefully they'll follow through and take it and learn it so that they can then apply it to your body and help you better.
Certainly. Okay, one question that keeps coming to mind. Do
Yeah.
you know, and I don't know if you're asking your clients this when they come to see you, what method of delivery, like if they were laying on their back or if they were
Oh,
squatting,
absolutely.
do
Yes.
you notice a pattern from style of birthing?
Yeah. I always ask that question of all of my postpartum clients. What position were you in when the baby came
Hmm.
out? Because in labor, you're probably in a lot of different positions, but it
Hmm.
really only matters what position you were in when the baby came out, because that's going to influence what pressures that your pelvis took. And so, yes, I always want to ask that question so that I know and I mechanically know what the pelvis went to. So a lot of people were, like, oh, well, I squatted, but this leg was up. Well, whatever leg was up more than the other, that side is going to be that ischium, that sit bone is going to be more splayed out to the side. I find that laying on your side, giving birth on your side, which is a great position to do for some babies, and some babies need you to be on your side to come out, but that tends to create more asymmetries in the pelvis than being on your back or squatting or hands and knees. But other than that, there's just different mechanical forces that get put on the pelvis depending on what position you are in. And as physical therapists or there's occupational therapists that do pelvic health work as well. And we all should know how to address the bones of the pelvis. But it's going to be my life's work to get this information out into all practitioners' hands. I want chiropractors to know about this. I want pelvic health PTs, OTs. I want midwives to understand this. Just more people need to understand that the thing is as PTs and OTs and chiros, we understand the pelvis does this anterior posterior rotation. And you may have, if you've gone to a PT, oh, you have a anteriorly rotated pelvis. That's so common. But what's not being looked at and addressed, which is so important for birth, is what happens to those ischial tuberosities. And that the splaying out to the side, and depending on what position you are in, how one side could be more splayed than the other, that's not being addressed by most practitioners unless they've trained with me and understand it in the way that I'm teaching it.
Mm.
And that truly is the difference between full recovery and not, in my
Hmm.
opinion.
I think there's a lot of mothers walking around not fully recovered. I think of myself, obviously, and the people I know, my friends. I'm like, I don't know anyone personally that saw a pelvic floor therapist after delivery.
In my dream world, everyone would be able to see someone that I've trained. Then I
Yeah.
know that they will have gotten the care that they need in order to recover fully. And that's going to be my life's work till I die, is to try to spread this to as many therapists as I can and practitioners as I can, so that more and more people will understand and know what to look for. I just saw someone today who worked with another physical therapist, and she did some good work in one area, but completely missed everything else that I addressed, that I was just talking about here. So just know that there's more support. If you're not getting the results that you want with your therapist, then there's other options out there. And working with someone who's trained with me would be that other option.
I think there's a big disconnect too between like the OB to PT realms because I have not had, and I've had three different OBs in different areas because we've moved. Not one has ever suggested that to me. And
Mhm.
also, I think we sometimes, I'm projecting here, but based on conversations I've had with other mothers, like, oh, this is just my body now. Like, this is just the way I am. So they
Yes,
don't even think
yes.
to raise their hand to their OB or get a referral. What's the
Right.
disconnect? Do you know?
Well, they don't understand. The OBs don't understand the importance of our work. They don't understand what we know. And you ask a OB, should I massage my C-section scar? And there's like, oh, there's no research supporting that. Well, no, there may not be, but in my clinical evidence, there is 100% difference when you massage your C-section scar and what that can prevent down the road. So if you've had a cesarean birth, please massage your C-section scar. I have a video on YouTube on how to do that. So you will have that in the show notes as well. But it can stop back pain, deep thrusting pain with intercourse, and bladder frequency. And sometimes those effects don't happen until 10 to 15 years down the road.
Wow.
And it's just the scar tissue is inhibiting the tissues from being able to expand and move as they need to. And so that's one thing, you ask your OB, well, should I massage this? And they're like, there's no evidence that says it's helpful. And I'm like, heck yes, there is. I have my girlfriend, she has the same age boys as I do. And when our boys were 8 and 10, her back went out on her and she came over to see me, and she had had two cesarean births. And when I worked on her, I didn't touch her back. I just worked on her C-section scar. She got off the table. She no longer had pain.
Oh
One
my
session,
gosh. 8 years later, this came up, and just doing
right?
that, that's incredible.
Well, here's the thing. 2 years later, she had had knee surgery, ACL repair. And that's a big, long, recovery. And she was hobbling around for months with a bad knee. Her back went out on her again. And so as a PT, I'm like, oh, well, her knee threw off her gait, threw off her pelvis, threw off her back. And so I adjusted everything but her C-section scar. I saw her the next day and she goes, no, I'm still in pain. We were at a school picnic. I laid her down on the picnic table and I released her C-section scar and she got off the table. She had no pain.
That's incredible.
So it was totally her C-section scar that is causing her back pain. And she sees chiropractor 2, 3 times a week for her back pain.
Mm-hmm.
And
Mm-hmm.
this is 8 to 10 years later, and nobody's thinking about a C-section scar at that time. And so the second time it happened, I'm like, you need to get in there and you need to release the C-section. You need to release the scar tissue, and this is going to help your back pain. But the thing is that not many people are putting two and two together there.
No.
And the other thing, the other avenue I want us to go down, if you don't mind, Shannon,
Please, let's go.
is the effect of trauma. So would you say that any of your births were traumatic?
I mean, not to the extent that others would, but there were traumatizing aspects for me. Yes.
Yeah. And I would say that most women would say yes to that in some degree, right?
Hmm.
I call it like small T trauma and
Right.
capital T trauma,
Yeah.
right?
Yeah.
However, that trauma registers in our body the same way, no matter if it's small t or capital T. And when we have a trauma response in the body, it's either fight, flight, or freeze. And in birth, you can't fight it and you can't run away from it. So your body's only reaction is a freeze response. And what that feels like to me as I'm working with someone is number one, their nervous system might be a little activated and elevated. And then there's like this holding, like the in the pelvic tissues. And it's like the pelvic tissues haven't like fully breathed and exhaled. And there is a flow of energy that's happening down and through our pelvis as that birth energy, as baby comes on out. And when there's a trauma response in the body, that can get stuck and cut off. If you've had a labored C-section where baby comes into the pelvis, I can feel exactly where the baby got to before it came out because the energy stopped and it hasn't continued on. So that trauma can be held in our tissues.
Yes.
And we can go do all the talk therapy we want, but it's still held in our tissues. And when I work with trauma, I work with it from a nervous system perspective and the tissue level perspective. Because in some regards, it's like the uterus, it gets in that freeze response, and it's almost to a sense that the body doesn't even realize that the baby's out
Wow.
and labor's over. And that is something that I work with my clients to make sure is like, does your body even know that the baby's out? Because our mind does, right? But to me, when I've been working on the body all these years, it almost feels like our mind is one level of consciousness and our body is a separate level of consciousness. And our mind knows that we're taking care of this baby and that this baby is born, but yet our body is still stuck in that moment in time in the birth and doesn't realize that the baby actually has come out and that the birth is over. And that's another indication, another reason that the pelvis might be being held in this open birthing pattern because it's stuck in trauma. And so
Wow.
if you go to do the exercise to close up the bones and it keeps coming back and you keep having the symptoms or whatever it is that you're experiencing with that, it could be because there is a trauma response in your body that hasn't fully released yet for your body to go, ah, and come back together again.
I'm so glad you said all that because I was thinking the body keeps a score.
Yes.
Okay, so how far out are you seeing? I know you give the example with the cesarean
Oh,
scar 8, 10 years later, but how far out from a birth are you still seeing this stuff very activated?
so when I first started discovering this and working with all my young postpartum moms, I'd say I'd been working with them for a couple of years. I flew home. I live out in Boulder right now. I was actually in Seattle at this time, and I flew home to St. Louis, and all my family is in Illinois. And I was home working with some of my aunts, and one of my aunts laid on the table, and I started palpating her pelvis, and I was like, this is exactly what I find in all my postpartum moms. Your pelvis is still open from your birth. She had a 42-year-old child at the time. And that's when I realized that it can last a lifetime in
Wow.
that birthing pattern. And she didn't even get into it with me, but she had a very traumatic birth with her first child. And it was still held in her tissues 42 years later. And I bet it's still in there today because she hasn't addressed it. And in working with her, her energy of the pelvic space is meant to be contained. The energy of our pelvic space is meant to be held within our body. And to me, it was like the faucets were just turned on full blast and were just flowing through her freely. And she had no containment of her energy. And she's a massive worrier, massive worrywart, and cannot sleep. And I really feel like I would guarantee that a large majority of that could be from her experience with her first child, who is now almost 60.
Wow.
Yeah.
Wow.
Yeah. So it can last a long time. And the other beautiful thing for all of us to know is that it can be healed at any time.
Oh, I was going to ask, that was one of my questions for you at the beginning, which you've so beautifully answered. But, for those of us who are farther out going, oh no, is it too late for us? Oh
Not
no.
at all. Not at all. It just takes a little bit longer because your tissues have been held in this position. And if we try to like make changes, it's just like, well, wait a minute, where am I supposed to be? And so it just takes a little bit longer to help remember where it's at. But the healing can always happen, especially
Sure.
the releasing of trauma. So just recognize that that trauma response in the body it's there to meant to protect you, but when you get stuck there, that your body needs help remembering where it is today. Like your cells, part of your cells, and I say it's a part of you got stuck in that birth, and the rest of you move forward in time. But that part of you is always going to be stuck there until you do the healing to bring all of your cells to present day awareness. And that's what true healing is.
Oh,
So,
that's so beautiful. I love that. Just the implications are huge,
right.
obviously, looking at your aunt,
Yeah.
but
Yeah.
like you said, you can heal it. So
Yeah. And
incredible.
and it also impacts our relationship with our babies. So when we and another aspect, so it can inhibit bonding with babies. I had one mom that came to see me, and she brought in her second baby to the session, and baby was in the car seat, and I worked on her, and she had a really traumatic experience with her birth, the second baby's birth. And she was just like, I just don't feel connected to this baby as like the first one. Like the first baby I bonded no problem, but this one I don't have a connection to it. And so we released the trauma from the birth, and it brought tears to both of us. She was actually crying. After the session, she breastfed her baby and she was just like, I feel like I'm finally connected to my baby now. And it was so beautiful to know that that repair can happen at any point. And I had another client who had a teenager and she healed something about her birth. And I remember her reaching out later and going, oh my God, my relationship with that kid is different.
Oh my gosh.
Yeah.
That's incredible. Oh,
Yeah.
I could
It
listen to those stories all day. That's incredible.
well, and one of the, is a couple of signals to know if your body's still traumatized from the birth is if you've had a cesarean birth and you can't touch your C-section scar. If like if it weirds you out to touch your C-section scar, that could be a sign that there's trauma being held in those tissues. And then if you think about your birth and you tear up about any aspect of it, that's a sign that you might still be traumatized from the birth itself. If you kind of always go back to a certain moment in time in your birth, that's a sign that your body kind of saying, hey, you need some help in that moment. There's something that needs to be healed in that moment. And truly, C-section, whether it's C-section scar or vaginal tearing scar that is really painful, that to me is a sign that there's usually a stuck emotion or stuck trauma in those tissues. Because as soon as you release the trauma, that tenderness and that pain goes away. I had a client that came to see me and she was 5 years status post her cesarean birth. And immediately after the birth, she had pain in her C-section scar. And she went on and had two more exploratory surgeries in that area because of the pain.
Wow.
And when she came to see me, now after her third surgery, 5 years later, constant pain for 5 years, she was traumatized from the cesarean birth. And that's what was creating the pain. One session, pain was gone because it was the trauma. And we need to understand that our medical system, our doctors do not understand the potential of scar tissue in the body and how it can impact things, and trauma and how that impacts and creates pain in the body. So not all pain is physical. We can have pain that's emotional. We can have pain that's energetic. We have pain that's trauma, and trauma is usually the energetic and the emotional together.
Right.
And that can create pain. So not all pain is physical. And when you address it from these other levels, the pain goes away instantaneously.
Mm-hmm. Okay, so if a mom is at home and is like, I'm very interested, but if they're anything like me, they're a little hesitant because if I don't know what I'm going to experience, I
Ah,
get nervous. So,
right.
what can someone expect with someone trained under you
Yeah.
versus maybe a typical pelvic floor
Yeah.
therapy session?
So I teach and I implore my therapists to never create pain. So if you've gone to physical therapy for a joint, a shoulder or a knee, and like no pain, no gain, that is so not the case when it comes to pelvic health. Like, we should not be creating any pain whatsoever, especially when you do intravaginal work. So when someone comes to me, that's the first thing I want them to know is this: look, my touch should always be gentle and loving and not invasive. If at any point it creates any pain or it's too much, you need to let me know. Okay. And so I teach that we should always respect the tissues, and that we should never force the tissues to release or relax, because there's always a reason that they're doing it. Remember, I talked about the pelvic floor muscles that are trying to hold you together. And if we force them to release, then your pain gets worse because we didn't address why they're tight in the first place. And so I really encourage my therapist to try to dive into what's the cause of the issue. And let's get to the cause first before releasing it so that we don't create more pain. So I teach a very respectful, create no pain kind of approach. And most pelvic health therapists are really good at explaining what they're doing and why they want to do what they want to do. And I really teach that we should not be doing intravaginal work unless your body is on board. So
Mm,
that's right. Like, if like, oh, I'm nervous about having this intravaginal, what are you going to do? If some people come in, they know they're coming in for that and their head's on board and they're like, yeah, I'm here, but their body's like, hell no. I listen
right.
to the hell no of the body.
Yeah.
We don't do intravaginal work until the body is on board and says yes. So that's super important too, so that we're not disrespecting the body in any way. And so I just want, if you are seeing a pelvic floor physical therapist and they're creating pain, stop, tell them not to. That's not okay in my world, in my book. And there's a reason it's painful, and you need to get to the reason. And once you get to the reason, you don't need to create pain to get it to release. So, and I also believe truly that we should be working externally on the body. So my clients are fully clothed the whole entire treatment until we get ready to do the intravaginal work. And then I will have them disrobe from the waist down and cover themselves up. So you're draped while we do the intravaginal work. I'm not looking and staring at anything because I can't see what I'm working with anyway. So you're completely covered, and I'm just palpating and working with the tissues with my gloved finger in
Mm-hmm.
vaginally,
Mm-hmm.
um, and just helping to get those muscles to function better. Because that's truly, the pelvic floor muscles and the belly are the two muscles that get so stretched out and lengthened during a vaginal birth. And the belly muscles are just lengthened. That's why you have that little postpartum pooch after
Mm-hmm.
birth. And so if you guys could, if you're listening and you put your one hand right underneath your rib cage and the other hand on your lower belly, and if you cough, your lower belly should draw in. And for a lot of postpartum moms, it pushes out. And that is your lower abdominal muscles have just gotten too lengthened and they don't know how to draw all the way back up and in anymore. And so we need to retrain them so that your muscles upper by your rib cage don't get as stretched out from the pregnancy. And so they're a little bit stronger. So the abdominal muscles are meant to stabilize your spine. And their job is to keep the spine still while you move your arms and your legs. And so if the lower belly that got so stretched out, it's so lazy that it just doesn't want to come back on, the upper belly is going to kind of stabilize you. And it does it kind of in a downward force where your lower belly comes out. And that's not what we want because that can put a lot of pressure down on our pelvic organs. And that pelvic organ being pushed down from the belly going out is what can cause us to leak. And so we need to learn how to activate, get our pelvic floor muscles to strengthen, to pull in our lower belly like we're zipping up a zipper. So when we go to pull our belly in, the lower belly should come in first, then the middle belly, then the upper belly. But a lot of times postpartum, the upper belly kicks in first, then the middle, then the lower. And that's why it kind of gets pushed down and out. So we want to think about zipping up the zipper as we pull our belly back up and in. And we need to strengthen it at its end range and tighten it, tighten it, tighten it, and tighten it to help it to relax or help it to strengthen to shorten back up again. Because it's just a lengthened muscle. That's why your belly is sticking out a little bit further than it did before you had kids. And it needs to be strengthened at its end range to shorten up that muscle again so it doesn't stick out as far as it is now. So
Okay, for the record, I know your answer, but I just want you to clarify for anyone who's wondering.
yes.
Should a postpartum woman at any stage be leaking for whatever reason when she sneezes, laughs, when she runs, when she jumps, for any, during any physical activity? Should she be leaking?
No, no, and no.
Okay, thank
No,
you.
it's common and doctors don't know what to do about it. So they just like, oh, brush it off. Oh, well, you had babies. What do you expect?
Yeah.
And it's like, no, it's common, but it's not normal. And any leakage is a sign of your core is not functioning properly. And it's very common after being pregnant because of, like I talked about, that belly getting stretched out, the pressure's coming down, the bladder being out of place. And all of that contributes to that leaking at any point in your life. If you're leaking at all, your core is not working well. And seeing one of the therapists that I've trained can help you to get that better much faster than working with just your traditional physical therapist. It
Mm,
can help, but it's just going to take a lot longer. So.
yeah. What should someone expect working with one of your trained clinicians versus the standard in like resolving an issue such as that one?
Well, what you should expect if the practitioner who studied with me and is using my work, you would expect them to address your pelvic bones first. You would expect them to address your skeleton, your external parts, the bones of your pelvis first, possibly working on your lower abdomen, where the bladder and the uterus externally, maybe working on your rib cage, but the bones of the pelvis they should be addressing to get them back into place first prior to doing any intravaginal work. So if your physical therapist is just doing intravaginal work and they're not touching your body outside of that, they are missing half of the picture.
Mm, okay. We've talked a lot about postpartum moms, but maybe there's a listener who's had a baby or two and is gearing up to have another one. What do
Yes.
you say to them if they're, planning or currently expecting?
It's super important for you to rehab your body as best you can in between pregnancies because we know that when we have pelvic floor muscles that are vibrant and strong and healthy, there's less chance of tears. Your perineal body is the opening of your vagina to the top of your sphincter muscle. And that measurement of that tissue, if it's less than 3 centimeters prior to labor, there's a less likelihood for you to tear and to have problems. So if it's less than that, there's a greater chance for tears. So we want to just make sure that we get some good healthy tissue in there, get some strength in those pelvic floor muscles prior to going into labor again, or prior to being pregnant again in labor. And the other thing I want pregnant mamas to know is that sometimes pelvic pain develops in pregnancy. And if someone's in a subsequent pregnancy and someone comes to see me and they're having pelvic pain, the number one question I ask them is, did you have this in a previous pregnancy? Because if they answer no, then I know it's their pelvis is just open from the first birth and that I just need to close their bones up and their pelvic pain will go away. After a baby comes out, there is no sense of normalcy in the pelvis anymore. The
Okay.
pelvis is like, it doesn't know what normal is. And you may be functioning totally fine. Maybe your pelvic floor muscle is a little bit weaker, but you're functioning until you get pregnant again. And now you add the hormonal laxity of pregnancy, and now you're starting to have all this pain. And that's just because your bones haven't come back together to their original position. Now we're adding the weight of pregnancy and the hormonal laxity, and that creates the pelvic pain. When you get your bones back together again, that pelvic pain goes away. So there's a couple of different things that can cause pelvic pain in pregnancy. And one is just a natural hypermobility. If you are really stretchy and bendy, then that can create pelvic pain because your joints just don't have the stiffness, the structure of most normal people. They're stretchy. And those stretchy types of joints don't like the relaxin and the hormones that pregnancy brings, and it just makes it even more stretchy and lax. So that can create pain there. But if you had a normal pregnancy prior, and now you're developing pain, your bones just are affected from the birth. And we need to bring them back together again. And then your pain goes away.
I love how straightforward you are in that pain is not typical and we shouldn't ignore it and we should honor and try to listen to what our bodies are telling us because I know, we go to the doctor and they're like, well, you're pregnant.
Yes, I know. And we just need to understand that doctors do not have all the training that physical therapists do. I mean, they know some stuff, but not all of it. And I don't think they have the full picture of how we can really support women. So that's, I
Right.
think, the reason why OBs, you asked that question, why are OBs so disconnected, is because they just don't understand the full function of it and they don't know that there is help and support for this. And
Yeah.
so you could demand that they refer you to a pelvic health physical therapist. You could,
Mm,
go and demand that they refer you to.
yeah.
But I want moms to know that, especially with our medical system the way it is today and the insurance reimbursement, that if you are adamant about using your insurance to pay for your physical therapy, you need to understand that you're working with the newer grads.
Oh, okay.
Okay? That most physical therapists who are going to be able to help you in the way that I'm talking about, the majority of them are private pay. So you need to take ownership of your medical health and your care and pay out of pocket. You are
Hmm.
worth it.
Yeah.
You deserve to take care of your body because nobody else is going to do it for you. And I just want you to understand, if you want to deal with insurance, and that's fine, I know we need it, but those therapists who take insurance, they work for a bigger system, they work in the hospital, they're young, they're green.
Hmm.
They do not know what most more experienced physical therapists know, who are out on their own and have their own practice
Mm,
and
thank.
our cash pay. And I want dads to know this because, there's a lot of women listening to this who will not pay for themselves. They will not think they're worth it enough to spend the money on themselves. Yet, if their partner knew that they were struggling to have intercourse with them because it hurt and they're denying them that connection, your partners would pay whatever they could to get
Hmm.
you better and
Hmm.
to get you connected and being able to enjoy intercourse again. And, I tell my mamas a lot of times for me, it's one session. That's all you need to come in, one session, and we can get you enjoying intercourse without pain. So know that there is help. If you went to a therapist using your insurance, 6, 10, 12 visits, and you're probably still not better.
Yeah. Yeah. And the way those copays add up or the deductible or
Exactly.
whatever you've got, right?
Yep,
Uh,
exactly. So think about that, everybody, as you go to make the decision of where do you want to go get your care. Oh, I want to use my insurance. Okay, great. What's your deductible? And how many sessions is it going to take for you to get better?
Right.
versus if you go to an expert who is cash pay and
Mm-hmm.
can get you better in 1 to 2 sessions.
Mm-hmm. Oh my
Yeah.
gosh. This has been so amazing. I just wish that I had this conversation with you before I had my children. Even, after the first, before the second, because
Right. Right. Yeah.
if we only knew. Please tell everyone how they can find you and follow you, and we'll make sure all of it's in the show notes as well.
Great. My clinical practice is centerforbirthhealing.com. So please go online and check out the website. And there's our phone number. There's a form you can fill out on our website to submit. And we can do a lot of the trauma healing on Zoom. So
Fascinating.
no matter
Yes.
where you're at, we can help you with the trauma from your birth, um, wherever you're at. So please reach out. We're happy to do that. And then I am in the Denver and Longmont location near Boulder, Colorado. So if anyone's listening in that area, please come see us in person. I love my hands-on sessions. And then if you're interested in the directory, I do have a online educational platform, which is the Institute for birthhealing.com. And the directory is on the Institute for birthhealing.com website. So under other resources in there, we'll give you the link in the show notes too.
Yes, and before that, I will be checking to see if there's anybody local to me because the number of times in this conversation, I was like, that's me. That's also me. And I know there are so many women who are thinking, huh, or have thought that the window of opportunity to help repair this has passed because it's been years.
You can always heal, everybody. You can always heal. And I just encourage everyone, please take care of yourself. Get the love and the support that you need to heal more, to function better. You do not and should not be living in pain or living with leakage because there is healing that can happen. So
Oh,
take care of yourself.
Lynn, thank you so much for your time today. I have learned so much today. It has been so wonderful. Thank you so much.
You're so welcome. Thank you, everybody, for listening in.
That's a wrap on another episode of the Having a Mom Moment podcast. Thank you so much for tuning in and for sharing this space with us today. Before you go, don't forget to check out the show notes for any links or resources mentioned in today's episode. And hey, while you're at it, why not give me a follow on Instagram and Facebook at Having a Mom Moment? You can also visit havingamaMoment.com for even more mom-inspired resources. If you've enjoyed today's conversation as much as I have, please be sure to hit that subscribe button so you never miss out on future episodes. And it would mean so much if you leave us a glowing 5-star review on your favorite podcast platform. Until next time, remember to embrace those mom moments, find alignment in your journey, and always honor the incredible woman you are. Take care, friends, and we'll see you on the next episode.